I'd like to introduce Battles from the United States, who is a big advocate of LDN. Thank you for joining me, Paul.
Thank you. Glad to join you.
Could you tell me when you first heard about LDN?
LDN, it was April, I believe it was 2007, when I was researching Crohn's disease, because my son was diagnosed with Crohn's disease, and I read Jill Smith's article in the Journal of Gastroenterology regarding her Crohn's study on LDN.
Mm-hmm.
And what we found was her response clinically was excellent. It was about 89% of them had a clinical response, and 69% went in full remission at about 8 weeks. Mm-hmm. Well, I read that article, and then my son, with his Crohn's, was somewhat stable on his azathioprine, that's Amuran, when he had a very significant exacerbation later on that year in October 2007. It was bad enough he went into hypovolemic shock and ended up in the hospital. Actually, we almost lost him. He was really, really a touchy situation, and they discharged him from the hospital with antibiotics and typical drugs, but he wasn't doing very well. So I went back to that original article, I remember, from Dr. Smith, and discussed it with another physician, Dr. Grossman here, who's familiar with low-dose naltrexone, and we decided to try it. Within 2 weeks, he was showing better color, doing well, and 3 months later, all his parameters were normal. He was BMX biking again, enough that he then ruptured his spleen on his bike, but he was doing very well. So because he did really well, that gave me the mission to spread the word. So then I went on to give a lecture at the American Academy of Anti-Aging Medicine, which had 4,000 physicians there from around the world. They all got tapes, and then they asked me to write a chapter in their therapeutics manual that then got distributed throughout the world in 100 different countries. It's just my mission to spread the word. I gave a lecture last April of 2011 in Florida to a similar type of conference, and I've been giving lectures here locally in the Denver metro area. Matter of fact, today in my clinic I have a multiple sclerosis patient coming in for LDN. Mm-hmm. So that's what gave me the impetus to really research and utilize LDN. I've also applied it to what's called complex regional pain syndrome, which is their old terminology is RSD. I had a patient who had it. We put a spinal cord stimulator in her, and she just wasn't doing well. She was a 23-year-old, wanted to be a college student, but she couldn't do it anymore. So she didn't want to go on narcotics. And I said, well, let's try the low-dose naltrexone, because it does modify all the cytokines that are known to be excreted in complex regional pain syndrome. Mm-hmm. I discussed with her about that and with her mother, and they agreed, and she went on it, and her mood was better. She never had to go on narcotics again. She took it for about a year and a half, finished her college, now is looking for a job, and she said she really doesn't need it anymore. It seems like what we did is re-regulated her immune system back to normal, and to this day, I think 2.5 years now later, she has not had to go back on narcotics. Mm-hmm. So we're trying to find multiple different applications that have to do with cytokine dysregulation of the autoimmune diseases, especially MS, Crohn's, rheumatoid arthritis, because Dr. Gironi in Milano, Italy, found that the endorphin levels are very low in those 3 autoimmune diseases, which we know naltrexone can elevate them or at least modify them by blocking the endorphin receptors. Mm-hmm. And so we find it's been very good. I had another patient with MS who had severe thoracic neuritis from it, and he did much better with it too for about a year. And then he had to have some other interventional medicine because his pain was spreading throughout his body and just wasn't up to par, and he had to go on narcotics. Therefore, I had to take him up to naltrexone.
Mm-hmm.
So that's kind of how I use it. That's what stimulated me to utilize that. I've been doing consults around the country for people with Crohn's and other autoimmune diseases with naltrexone, and hope to really make it available someday if the FDA approved it. I had a lunch with Dr. Jill Smith. Finally met her last year, so we've been going back and forth about funding and research regarding LDN, and that's one of my goals, is to try and get funding for more research for it, just as you are.
Yes. How old was your son when he started LDN?
He was about 14, and he's almost 19 now.
Mm-hmm.
So it's been 4.5 years or so.
And he's
tolerating it very well.
Mm-hmm. Good. Okay. What would you say to people who are contemplating trying LDN but may be a little bit scared?
Could you repeat the question, please?
Yes. What would you say to people who are contemplating trying LDN but may be a little afraid?
For their fear, what I would relate to them is the safe drug history over the last 35 years, that it's been around for a very long time, and most people are using 15 times the dose that we use for drug addiction, alcohol addiction. So I would just go to the safety record of it. I would go to the minimal side effects, where there may be some people have little sleep disturbances, and the other is the cost. We can get it here for $15 to $20 per month, as opposed to many of the prescription drugs. For example, with the Remicade, it's $5,000 per IV for Crohn's disease and rheumatoid arthritis.
Mm-hmm.
And that's one thing I don't understand, where the standard medical doctors don't want to even be interested in it. With the safety profile and the economics of it, it really is kind of a no-brainer of why not try it. So that's those are the two things I usually tell patients, is the safety and the economics. It's really very low financial and medical risk.
Thank you very much, Paul. I really appreciate it.
You're welcome.
Great.